Good evening, everyone, and welcome. Thank you for joining us tonight. In everyday life, our minds tend to get a little bit chaotic. They move in all sorts of directions with tasks, to-do lists. Our swirl of thoughts and emotions keeps our perception fragmented, which prevents us from connecting to our deepest self, our essence of being. Mindfulness is an entry point into the internal well-being of ourselves, our health, and our vitality. Many studies correlate consistent meditation and mindfulness with reduced levels of the stress in our bodies, increased sleep patterns, the ease of depression, anxiety, lowered blood pressure, and reduced inflammation. All of this sounds great, right? So how do we start? Being mindful is simply the process of bringing your attention into the present moment. Without judgment, just noticing where you are in the here and the now. So I'd like to start this session by everyone taking a few deep breaths, which is how we can easily come into the present moment. So begin with a nice, long, deep inhale and exhale. We'll do that 2 more times. Inhale and exhale. As you arrive here in the room tonight, just allow yourself to be here in the moment. Let go of anything that was going on before you got here, and let go of anything that you have to do when you leave. Just stay right here in the moment. And without further ado, I'd like to introduce our moderator, Dave Sargent. Please help me in welcoming him to the stage.
Wow, I'm all calmed down now. This is a rarity. Let's see, I would like to introduce our speakers. Our first speaker this morning is Dr. Alexander Ellis, a gentleman who is nearest to me. He's board-certified family medicine physician. He obtained his medical degree from Howard University College of Medicine in Washington, D.C. Because of his interest in population health and public policy, he subsequently went to Dartmouth, acquired a master's of public health. Dr. Ellis did his internship and residency training with Dignity Health Methodist Family Medicine Residency in Sacramento. That's a mouthful. He enjoys caring for patients from adolescence through all stages of adulthood. He grew up in New Jersey, but has lived in Southern California since shortly after completing his undergrad education at Franklin and Marshall College in Pennsylvania. He's happily married, loves to read, and enjoy outdoor activities, including scuba diving. Please welcome Dr. Ellis.
Good evening. Okay, I am going to talk about healthful goals for starting the new year. We want to get going. The thing I'm a family medicine practitioner, primary care, so first thing I recommend is invest in your own good health. And one of the things I say is don't make a bunch of resolutions. You need to make a plan. Resolutions are a lot of promises, and promises are unfortunately broken very easily when we make them to ourselves, unfortunately. And keep it simple. It can be as simple as, I just want to stay healthy. If you're in good shape, that's great. Or you may need to actually get healthy. And you know who you are. You know you're not feeling well. And those are the people I recommend come in. Make an effort to see your primary care doctor. This is the time to say, hey, I've got this pain, this rash, this mole, anything I've been thinking about getting done that I've been putting off. Now's the time to go see your physician and make that part of your goal for the new year. Among other things that you might want to consider if you haven't done so already is actually meet your doctor. There are people who say, oh, I've got a doctor on my card. I've never gone to my doctor in the past 5 years, but he or she's been on my card. I know who that doctor is. This year would be a good year to step out and actually meet your doctor. One of the things I recommend is going for an annual exam. Find out exactly how you're doing, what's going on with you. It can be as simple as getting basic lab tests, going in to see your doctor to review your medications. Some people have none. Some people may have a list that's like 15 medications long, and many of them you may no longer need. Some of them you may continue, but it's always good to get that checked periodically, because what happens is you have a medical condition, and it's not unusual for a physician to prescribe something because you need to be taking it, and then another physician, another specialist prescribes something else, and after a while your medication list grows and grows and grows. It's a particular concern among the elderly, and we have a name for it. It's called polypharmacy, meaning many drugs. And one of the goals in primary care is to make sure that you're on the minimum drugs you need to stay healthy. If you need none, that's great too. So reviewing your medications is one of the things that can happen if you visit your doctor. Next, review how you've done over the past year. If you had some goals over the past year, check in with your doctor. Have you lost the weight you were planning to lose? Is your breathing better? How's your heart condition or your diabetes more under control? These are things that by getting checked annually, you get an assessment of where you are, because it's easy to think, oh, I think I'm doing fine, without actually checking. An annual physical exam is usually by calendar year versus 365 days, but you need to check with the insurer regarding any restrictions they may have. Now, you compare an annual exam to a Medicare wellness exam, because I know a number of people have Medicare as their primary insurer. There is a slight difference in what's considered an annual exam versus a Medicare wellness exam. Medicare has very specific guidelines that they expect us to follow, both you and your doctor. The wellness exam, believe it or not, is not the classic physical exam. It's very, very thorough. It involves an assessment of your physical and your mental health. But it is slightly different from a physical. Unlike the annual physical exam, a Medicare wellness exam does require that you be at least 365 days between those wellness exams. The wellness exams, however, do not preclude going in to be seen for any specific concern that may come up. So if you need to be seen for something that needs to be physically checked, you can be physically checked, but the so-called classic overall physical is not included as part of the Medicare wellness, except as the very first Welcome to Medicare visit. One of the things that you want to do is maintain your health throughout the year. Go into certain recommended screening things. For women, the mammogram is one. The mammogram recommendations sort of vary between different organizations. American College of Obstetricians has one. I belong to the Family Medicine Board. Our guidelines say starting at age 40, we should start offering it to women between 40 to 44. And then at 45, we should tell them that it really should be a routine part of their yearly physical checkup up until about age 55. And then at 55, we say you can probably go every other year for a mammogram. My particular board does not have a cutoff time that we recommend that you stop. We base that on how the patient herself is doing. Is she healthy? Do you think she's probably going to live 10 more years? Then yeah, we say continue with the mammograms. But as many women here will tell you, they're not the most comfortable things in the world. So if they don't need it, they're not in good health, we're not expecting them to have a prolonged life, why put them through the discomfort? The odds of getting cancer decrease as you get older with breast cancer. However, If it looks like you're going to have a good long life, another 10 years, you're 85, it looks like you're going to be there another 10 years, you should definitely get checked because you're still at risk. Health maintenance includes other things such as colon cancer screening, and this is men and women. In general, the average person at average risk, we say we start screening them at age 50. The Affordable Care Act that came out says anything that's recommended by a United States organization called the Preventive Service Task Force, all those things should be covered by all your insurers as a free benefit. So colon cancer screening is one of the things that should not cost you anything. However, if you're not at average risk, and a person not at average risk would be someone who has usually a first-degree relative who has had colon cancer. And that we recommend you start 10 years earlier than when that person was diagnosed. So for instance, if your father was diagnosed with colon cancer at age 53, you should get your first screening at age 43. If that screening is completely normal, you may not need to repeat again until you hit 10 years, and it varies by what type of screening you go with. Colonoscopy, which is the gold standard, and the one I generally recommend, is the one that all the other ones eventually get compared to. A colonoscopy has the advantage of the doctor's actually checking your colon. He's visually seeing what's going on. If they find something that's abnormal, they can actually take a sample, and that sample, if the sample's abnormal, sometimes that polyp, what we call a polyp, if that's totally removed, that may be the entire risk factor and it's gone. Other things you can try are DNA screening. On TV, you may have seen ads for something called Cologuard. That's basically a DNA screening. They're checking for evidence of cancer DNA in a stool sample, and it's actually very accurate. If that's normal, then the interval can be 3 years. There's another one called fecal occult blood testing, long name. Basically, they're checking for blood in stool, blood that's not seen. If that's normal, that's every year. That's a yearly thing. But if either of the DNA screening or the occult blood screening is abnormal, they default to you've got to follow up with the colonoscopy. So my recommendation is find out what screenings you need, what screenings are open to you. Go for them every year. Make that part of your yearly thing. Is this a year I should be going for my colon cancer screening? Did I get my mammogram last year? Am I supposed to get it this year? Follow up with that. Now, vaccines. Vaccines are important. Now, I know most of us have had shots from the time we were kids. They're not comfortable. No one likes getting stuck with something sharp. But they do have advantages. This year, the CDC estimates that there have been 9.7 million people with the flu. This is as of December. 87,000 hospitalizations and over 4,800 deaths from the influenza virus. Yeah, so with the number one vaccine I'm talking about right now, obviously, is the annual flu vaccine. You do need to get it each year. I know people say, oh, it doesn't always work, even when it's not perfectly matched. And each year, to be honest, it is a guess. They take a look at what viruses are out in the wild and which one seems to be the most dominant, and then they have to get vaccines manufactured for a large populace. So based on an early projection of what they think it's going to be, they sort of tailor the vaccines each year to what they think is most effective. But even when the vaccine misses, it's an exposure to your body as to what flu might be, and your body sort of cranks up the immune system a little bit so that even if you catch the flu that year, you will tend to end up with a milder version of it for a shorter period of time than the person next to you who skipped the vaccine altogether. You start vaccinating at as early as age 6 months, and we continue basically for the rest of your life. If you absolutely hate needles, there are alternatives within a certain age group. There is a flu spray, a nasal spray that's taken, and is offered for ages 2 through 49 as an alternative. Not all doctors carry it, not all drugstores carry it, but it is an alternative. And this is a popular one, catching the flu from the flu vaccine. No, you cannot. However, it is entirely possible that after you get the shot, not only will your arm may be sore, or some people even have like a feverish for like a day, day and a half. That's because part of what the flu vaccine is doing is it's trying to kickstart your immune system. So people do sometimes feel unwell after they get the flu vaccine. The flu vaccine, another thing you should know is the flu vaccine takes about a week to come up to full effectiveness. So I'm sure some of you have had friends who said, I took the flu vaccine and like 3 days later I had the flu. You were already exposed, you got the vaccine a little late. But it is designed to help you get some protection. Other vaccines that are important are things like pertussis. This is whooping cough, what's known as whooping cough. We worry about it as children, but we also have found that when I was a kid and I got it, we were told that you got this, boom, bam, you're covered the rest of your life. We've since found out that that's not the case. Any of you have relatives who have recently gotten pregnant, I'm sure the new mom is telling you, you can't come to see the baby until you go out and get your pertussis vaccine. That's because we want to make sure that the little one who has almost no immune system doesn't contract it from when the adults coming to visit. And we also found out that if you contract it at a later age, you sometimes have as bad a response as a child who has never gotten the vaccine. So we do recommend that. There's also a pneumonia vaccine. There are two, actually, and they're taken approximately a year apart. If you have some sort of comorbidity like heart disease, lung disease, you don't need to wait until you're age 65. Those, in this case, we recommend getting started even earlier to protect you because your lungs are already at risk. Other vaccines are ones such as the shingles vaccine. The shingles vaccine is quite effective. Unfortunately, the manufacturer did a better job at marketing it than manufacturing it. They've been back ordered. We're catching up now, but they were back ordered for months with people coming in and being put on a wait list. But if you've ever had chicken pox, that means you still have the virus in your body. It just got dormant, and as you get older, if your body's under stress, it can erupt as a shingles outbreak. Other vaccines are the various pediatric vaccines. I won't get into detail with all of them because there are multiple ones. But any of you who have children, you should definitely follow up with the schedule with the pediatrician on what they should get. The number one that sort of overlaps childhood going into young adulthood is Gardasil, which is the one for the human papillomavirus, which is the virus that most often causes cervical cancer in women. But men can get it too, and it can be effective with them. And so that's available starting at age 11, boys or girls, all the way up into the late 20s. Other thing I want to talk about is be aware of your body, what your weight is, what your body mass index, BMI, is. We say this not because and for healthcare professions, we're not into body shaming or anything else. Cardiovascular disease is one of the #1 killers in the U.S., and it affects virtually everyone to some degree. Weight, the more weight you carry, the more likely you are to have cardiovascular disease. Pretending that you don't know your weight doesn't lead to health benefits. So not looking at the scale does not mean your things are going to be good. What is body mass index? What it looks at is your actual weight in reference to your height. And each series of numbers tells you where you are on the BMI schedule, whether you're within the underweight, normal, overweight, or even the obese category. Each of these has ramifications. Okay. Now, I'll let this come up and then I'll go further on. Part of knowing, maintaining a healthy weight is doing things like exercising. It helps with not only the physical benefits, it also helps you relieve some of the stress, which my colleagues are going to get into and how we started talking about mindfulness. So exercise is a way of promoting your own health. And by exercise, I'm not talking about knocking yourself out. It can be cardio as simple as walking every day. Running is good, but that has a lot of impact on your joints, so it may not be the thing for you. Swimming is great. That's a zero impact sport. Weightlifting has the advantage of burning calories not only while you're doing it, but afterwards, because your muscles have to recover and they have to build back up, so your body continues to burn calories doing that. There are other things as simple as yoga, Tai Chi. Water sports are great. There are people here who've surfed most of their lives. Believe it or not, that's actually a form of exercise, although it's just enjoyable if you like surfing. There are multiple different ways to exercise. Find something that you enjoy doing is what I recommend, and do it. We used to ride bikes and run in the park, and when we were kids, we called it play. We got older, and it became exercise, and it became a thing. But find what you like to do and move forward with that. In addition to exercise, all of that means nothing if you're not involved with what you eat and staying healthy. My colleagues are going to get further into it. I'm just going to touch on it briefly. When we talk about nutrition, you should also enjoy what you eat. I know there's a lot of talk about you should eat this and not that. Food should be enjoyable, otherwise you're not going to stick to whatever form of diet that you're following. But you should figure out what are healthy diet choices. The two diets that I recommend, formal diets I recommend, are, I will get into in a second. Dieting I know can be tough, and one of the reasons it's tough is it becomes this thing that you're doing. And most people, when they go on a diet, are thinking about when are they going to be finished with the diet. But if you look at it as a lifestyle change, it makes a big difference on whether or not you'll be able to maintain it. It's like, okay, I'm not the person that eats, a slice of pie every night anymore. I'll have a piece of fruit. I eat vegetables more frequently. Plant-based diet is often in the news, and there's a good reason for it. We've come to realize it's one of the ways that, one of the things that promotes good cardiovascular health. And by plant-based, I'm not talking about you need to become vegetarian or vegan, but you need to increase, what we recommend is increasing how much vegetables and fruit you include as part of your diet and making that more central to your diet as opposed to red meat. The two diets that I recommend the most are one called the Mediterranean diet, which is named as a diet because it was what we realized is going on in another part of the world. We looked across the sea and said, why are people in this region of the world have a lower cardiovascular disease than we have over here? And that area that we were looking at was in the Mediterranean. We realized the things that they were doing, they were eating a lot more fruits, vegetables, nuts, a lot more whole grains. Their diet was more fish-based than red meat-based, and they were eating a lot less unhealthy fats. So they were using olive oils instead of other fats and oils. The other diet I recommend is the DASH diet, which is similar to the Mediterranean diet, but its focus is more on not only those things, but lowering your sodium intake. And this is particularly what we recommend for people who have high blood pressure. It lowers you reduce your salt intake, and you use a lot more low-fat dairy in your take. And my recommendations for this year are just to invest in your health. We talked about meet your primary care at least once a year. Discuss what your goals are, and work out an individualized plan for you. What will make you healthy? Stay aware of what the screening exams and tests are that are available to you. Make sure to get the recommended vaccinations at the recommended times. Know what you weigh and the implications for your weight. And just get a sense of how your body is doing. A lot of times, I've had times when patients have come into me, I met for the first time, and they said, I've been feeling like this for like 5 years. I haven't gone to a doctor, and then I have to do a workup, and I come out, oh my goodness, this is really bad news. And I'm telling them they've been staying away from a doctor, and then the first thing they hear from me is bad news after I get the results. So one of the things I recommend is stay on top of what's going on. Pay attention to your body. Has this been feeling bad for a while? Okay, let me get it checked out. This is the year to start fresh, look over. Exercise we talked about, and then focusing on healthy eating choices. With that, I'd like to say thank you very much for your attention.
Thank you. Thank you, Dr. Ellis. That was very informative. Our next we have, I'll call it a tag team match. We have two registered dietitian nutritionists. The young lady closest to me, next to Dr. Ellis, is Kristen Hung. She's a registered dietitian nutritionist who's been serving at Torrance Memorial for 4 years. She works in both the inpatient and outpatient settings, providing nutrition care and education to members of the community. She particularly enjoys disease prevention and early nutrition education for kids and families. Kristen received her education at the University of California, Berkeley and the University of California, Los Angeles, completed her dietetic, pardon me as I choke on my tongue here, internship through the VA Greater LA Healthcare System. Now next to her is Noel Lee. She is also a registered dietitian nutritionist who aims to heal and nourish through proper nutrition. She enjoys navigating the unique challenges presented by both inpatient and outpatient care, combined with the diversity that exists among her patients. She continues to build on her expertise by attending various conferences and seminars annually, with a particular focus on weight loss management and disease prevention. Noel received her degree from the University of Minnesota, Twin Cities, completed her dietetic, I have trouble with that word, it's terrible, internship through the University of Minnesota Medical Center. So please welcome Noel and Kristen.
Thank you, Dave. So like Dave mentioned, my name is Noel, and beside me I have Kristen, and we both work at Torrance Memorial as registered dietitians, both in inpatient and outpatient. So tonight we'll be talking about mindful eating, and this is actually a technique that we often encourage our patients to use when they're trying to get back to changing the way they eat and overall improving their nutrition. So what are we going to cover tonight? So we'd like to cover, define and determine the differences between mindless and mindful eating, why practicing mindful eating could be beneficial for you, and then understanding the different internal and external cues that drive us to eat and how we can navigate them. And then also, lastly, we'll provide you with some recommendations on how to reset your appetite. But before I want to jump into this, I want to kick it off by kind of doing a simple yes and no questionnaire, and I hope you can all participate. And of course, you can keep your answers to yourself as I go through each slide. Okay? You can already see the slides, I'm sure. Okay, the first question. You just got home from a stressful day at work. Do you reach for whatever food is available and not think about what you're eating? Take a moment to think, yes or no. Okay? Maybe tell your neighbor. While preparing dinner, do you find yourself nibbling on the ingredients as you cook? Yes or no? Okay. At a restaurant with friends, do you eat from the breadbasket until your meal arrives? Oh, I hear a lot of yeses. When you're pressed on a deadline at work, do you eat whatever you have time for and have it while sitting at your desk? Okay, and last, at a party, do you sample whatever passes your way and park yourself by the food table? Okay. So if you find yourself answering a lot of yeses to these questions, you're likely partaking in mindless eating, okay? So without realizing it, you could be consuming a lot of extra calories throughout your day. But what the heck is mindless eating, right? So simply put, mindless eating is eating that occurs when your mind is distracted, okay? So that person may not know what they're eating or how much they're consuming, right? So I want to talk about some of the main points that cause mindless eating. And as I go through each point, I want you to reflect. and see whether maybe you exhibit some of them, all of them, okay? The first one is disinhibition. So essentially, this is eating when you're not actually hungry. And the best example of this is eating when you're bored, which I think a lot of us can relate to, right? The second one, distracted eating. Who here eats when they drive? Okay. Who here maybe eats while they're working? Okay, see more hands. So distracted eating is eating that occurs when your mind is sidetracked with other things, some of the things I just mentioned. Others can include maybe eating when you're watching TV or digging into that bucket of popcorn at the movies. That counts too. Or maybe you're dining out with your friends and family, so you're having a nice conversation, and that can actually also sidetrack you, right? You're enjoying your meal, you're eating, you're enjoying your meal, you're having great conversation, you look down, your plate is done, it's empty. And you're like, wait, I'm not full yet, I could eat more, okay? Lack of awareness. That is another reason that can contribute to mindless eating. This is essentially not being aware of the amount of food you're consuming. This often happens when you're eating directly from the container, from the bag, or you didn't pre-portion out your meal or snack. Okay? Emotional eating is another one, and that is a big one. That's when we use food to comfort us, right? To improve our mood. How many of us, after a long, stressful day, we come home, we start craving something a little sweet. And then we have something a little sweet because we just survived the day. We deserve it, darn it. Okay? That's emotional eating. And lastly, eating in the response of external cues, which Kristen will be going into more detail. So that is that on that part. But now that we have a better understanding of what mindless eating entails, I want to talk about what mindful eating is. First off, the principle of mindful eating is a practice based on Buddhism, and it's actually become very popular method for people to work on changing the way they eat, their behaviors, their habits. Mindful eating is eating that occurs when one is present in the moment and aware of the eating experience. That means you're aware of what you're eating and how much you're eating. It is process-oriented rather than outcome-driven behavior. This is because it's based on your experience at that moment. You're focusing on how you're eating, what you're eating, whether you enjoy it. And so you're less focused on, oh, I should be restricting myself. I should be concerned with maybe I should or shouldn't eat this particular item. That's not the point. However, still, with this approach, you become more cognizant with what you're eating, how much you're eating. So that kind of results in you making choices that could be, oh, maybe eating a little less, savoring a little more, and selecting certain food items that are more conducive to healthier outcomes. So the purpose of mindful eating isn't to lose weight. No, it actually isn't. But it's more of a happy side effect that happens when you adopt this style of eating. Yeah. So the focus, or rather the principles of mindful eating, it's based on these three main things. Honoring one's body. So that entails becoming aware of your physical hunger, your satiety cues, and letting that guide you to decide when to begin eating and when to stop. Sensory awareness. That's when you use your senses to select your foods that are satisfying to you, that will nourish you. That includes texture, taste, smell, the way it looks. But this also forces you to slow down and focus so that you can fully immerse yourself to your senses, right? Because who here can say that they chew their food to applesauce consistency before they swallow? Yeah. And last one, judgment-free. So this is eating and acknowledging your response to the food, to the item that you're eating without any judgment. That means there is no right or wrong way to eat, and you're doing it with no judgment, right? So why mindful eating? I just said all these things. Now we all know it a little better, but why mindful eating? Well, the habits that lead to overeating are unconscious behaviors that are deeply rooted, right? Over years of repetition. We don't realize what we're doing. And for a lot of us, eating has become a mindless act. Do you agree? Yeah. So So therefore, mindfulness is such an important component to facilitating behavior change, right? It allows us to refocus our attention, slow down, and make eating an intentional act and not an automatic one, right? It's only when we're aware of our actions that we can change it. Do you agree? Yeah. And so through mindful eating, we're able to address things like binge eating, emotional eating, eating in response to external cues. Also, there's the potential of improving disease-related outcomes. So before I really want to jump into that, I want to first talk about some well-known programs, or I want to talk about a well-known program that a lot of studies have used this program to examine the effectiveness and the effects of mindful eating. The program created by Jean Christeller is called Mindfulness-Based Eating Awareness Training. The program combines mindful eating with meditation practices, didactic instruction, and self-reflection. And the point of this program is to cultivate awareness and allow people to have a more balanced and positive relationship to eating, weight, and their food, right? So I just want to go ahead and read a few studies that I found that was interesting and relevant. One study that examined this particular program reported that the number of binge eating episodes among participants decreased from a little more than 4 times per week down to 1.5 times per week. And then I also want to note that individuals who experience binge eating disorder, they're more likely to be overweight and obese. And we know that there's a lot of diseases associated with that. This program has also been used to target stress eating and elevated cortisol levels. Obese participants experienced significantly lower cortisol levels and decreased anxiety, although no change in their weight. However, control subjects gained a significant amount of weight. Also, patients who reported the greatest decrease in stress also experienced the largest decreases in abdominal fat, which may be useful for lowering risks of metabolic syndrome over time. Okay. This next one is not using the Christeller program, but also employs mindful eating techniques. And what the University of Texas found when they conducted a randomized controlled trial that examined mindful eating, specifically targeted at dining out, they found that there was a significant reduction in weight, calories consumed, fat intake, and increases in self-confidence among their participants. Okay? And then lastly, there has also been other studies that hypothesize that mindfulness may support necessary dietary changes that are crucial to managing diabetes, improving inflammatory markers, and lowering the risk of prostate cancer recurrence. So I really hope that this leaves you with some food for thought. But before I pass this along to Kristen, I do want to briefly mention the difference between mindful eating and intuitive eating, because often those two do go together. You can consider intuitive eating as the parent philosophy to mindful eating. And intuitive eating, as it is read here, is a broader framework that goes outside the eating experience, encouraging people to actively reject diet messaging and change their relationship with food and their body. Whereas mindful eating is about being present in the eating experience in a non-judgmental way. Okay, now I'm going to pass it on to Kristen.
Thank you, Noel, and good evening, everybody. As we consider how to incorporate mindful eating practices into our lives, we would be wise to consider some of the factors that play a role. So consider with me some of the following. The familiar smell of freshly popped popcorn as you walk into the movie theater. The distinctive sound of that crinkly chip bag as that's popping open. Or that bright marquee of a fast food restaurant as you drive home from work. Think with me, how often do we respond and eat related to cues like these that are not related to hunger? Every day, we are inundated with cues to eat. Some that we are aware of, and many that we're actually experiencing subconsciously. Some that are helpful, but a majority of them are unhelpful when it comes to us eating mindfully. Consider this scenario. You experience a cue to eat, such as seeing the Cinnabon shop while you're shopping at the mall, but more importantly, smelling that almost irresistible aroma of freshly baked bread with that browned butter and that warm brown sugar and that fragrant cinnamon. Then you have an expectation of reward, anticipating the pleasantness of experiencing that gooey bun as you bite into that sticky bun. Then you have a desire to eat to obtain that expected reward. Sometimes we may misinterpret this as hunger. Oftentimes this results in an eating episode. In this case, eating a sticky, gooey cinnamon bun that likely you were not planning to eat when you first went to the mall. As Dr. Linda Craighead explains in her book, The Appetite Awareness Workbook, this cue cycle can be stimulated by both internal and external cues to eat. Internal cues to eat are those signals that come from within ourselves, versus external cues to eat are those signals that occur within the environment around us. So let's take a look at some examples. Internal cues include that helpful cue of physiological hunger. So when are we hungry and when are we actually full? But also some of those less helpful cues of emotions, mood states, stress, desire for indulgence, and cravings. External cues include a lot of things that are related to our senses. The sight of food, seeing other people eat food, seeing food advertisements, seeing pictures of food, smelling certain foods, even hearing sounds that we relate to certain foods. Also, different activities that we often associate with foods can be cues to eat, such as sporting events, movies, and the like. Parties and celebrations can be other external times where we have cues to eat, and those can also include social pressure to eat as well. Variety, habit, the amount of food that is served, the size of container, and regular meal times, these can also be external cues to eat. How do we navigate all these cues to eat? A good place to start is for us to learn how to attend to those internal appetite-based cues. These are dependable guides to help us eat in a way that feels healthy and normal. We often start off as babies with a good appetite-based internal cues, but oftentimes we lose these as we get older. There are certain external cues that are also helpful for us, such as smaller plates and dishes and regular meal times. These things are helpful because they help us to eat in a way that supports our internal appetite-based cues. So when these helpful internal and external cues are used together, we can be protected from a lot of these unhelpful cues that encourage overeating or restriction. Let's take a quick look at some practical tips for choosing some more mindful eating practices. The first tip I'd like to share tonight is managing those unhelpful external cues. Try removing distractions, putting the phone away, and trying to even consider eating in silence so you can really attend to the eating experience and how your body feels. Remove unhelpful external factors such as tempting treats from sight. They've actually done studies that when those tempting foods are removed from the countertops and put even in opaque or in the cupboard in brown paper bags, a lot of people consume them less. And when the fruit is out on in a bowl on the countertop, those are the types of things that we go for. So really, out of sight, out of mind does work here. Avoiding buffets. I really encourage my patients to avoid buffets because a lot of times you will eat a lot more than you plan to eat, or even that you would eat at a regular restaurant. And even if you find that you're tempted by that same restaurant on your way home from work, find a different route home so you're not susceptible to that external cue. The second The second tip here tonight is to utilize helpful external cues. My first tip here is to really plan those balanced meals and snacks at regular intervals. What you'll do here is prevent yourself from getting over hungry and also reduce your temptation to graze during the day. You can also purchase individually portioned packages or pre-portioned bulk items to reduce the amount that you eat, and use smaller dishes and utensils. What these things do is they cue you to stop eating at a more reasonable portion rather than mindlessly continuing to eat. They've actually done studies where they have bowls that have a tube connected to it, and they're constantly refilling the person's soup bowl with more soup. And the people that have these endless soup bowls, they actually end up eating way more, but they don't think that they do. So those smaller utensils, smaller dishes, they actually do make a difference. The third tip is to challenge those unhelpful internal cues. When you're eating, ask yourself, why am I eating? Am I hungry? If you have a physical hunger, then go ahead and eat. But if you notice that it's actually more related to a mood state or it's related to stress, then consider if you can learn how to appropriately address these issues and attend to them in a different manner. The fourth tip is to tune in to those helpful internal cues. You may consider a period of monitoring your appetite to gain awareness of hunger and fullness. So think about, did you wait till you were too hungry to eat, or did you eat until you were too stuffed? Consider why that happened. Actually, monitoring these things can create a good awareness of your eating patterns and what you're doing with your hunger cues. Check in several times during your eating using the hunger scale. Notice when you're very hungry, when you become neutral, when you start feeling satisfied, and if you become overfull. Really slow down to increase awareness of your body signals, since it does take time for your mind to register fullness and also satisfaction. The final tip tonight is to commit to practicing mindful eating. You can remember some key tips about mindful eating using this word savor. First, sit and slow down. This means don't eat your chicken standing over the sink. And also consider slowing down by putting your utensil down in between bites. Some people even try using their non-dominant hand to eat or use chopsticks. A second tip is to pay attention to the eating process. So like I mentioned before, remove distractions and really put your phone away. A lot of times we don't notice. We feel uncomfortable sitting and eating by ourselves in silence, but a lot of times that really does help with the mindfulness practice. And as you do that, you're able to really attend to what you're eating and also how your body's responding. Next, value the food journey. Think about all the resources and all the people involved in bringing the food you're eating to your plate. Think about actually the cultural influences and traditions that are represented in the food that you're eating, and appreciate those aspects of the food. Next, observe without judgment. So use your senses to really observe the food. What is the texture of the food? What different flavors are present? What different colors? And what's the appearance of the food? And then try not to bring in judgment to it. So when you do eat, think about, how is my body responding to the food? Do I like the food? Do I dislike the food? And try to do those things without judgment. And lastly, respect your body. When your body's telling you that you've had enough to eat, then stop. If your body's saying it's still hungry, then go ahead and feed it. In summary, remember that mindful eating is more about how we eat than necessarily what we eat. You can be mindful while you drink water, while you eat vegetables, or while you eat a piece of chocolate cake. Know that mindful eating can help reduce some unwanted eating behaviors such as binge eating, emotional eating, and also eating related to external cues. It will take some practice to start attending to those internal and external cues to eat, but remember that this is a skill that can be practiced. If you're interested in learning more about topics like mindful eating or other nutrition-related topics, we do have a course called Core 4 that is starting its next session next week. And in this class, we do talk a lot about appetite awareness and learning to know our hunger signals and attend to our physiological versus psychological hunger. And so we invite you to visit our website to learn more information and to register for this course if you are interested. And lastly, I'll leave you with a Zen proverb that captures the simplicity of mindful eating nicely. When walking, walk. And when eating, eat. Thank you.
Thank you both very much. It would appear that pizza and beer isn't going to do it. Sigh. Our last speaker this evening is Valyn Carenza-Pack. She is a certified meditation, yoga, and Tai Chi instructor with a master's in clinical psychology. She also is a practicing massage therapist of 30 years with a focus on customized treatment programs for orthopedic, neurological, and chronic pain conditions. She facilitates a mindful meditation class here in this building in room 3 on Tuesdays at 4:30 p.m., and it's free. So please help me welcome Valyn.
Thank you, everybody. Good evening. So mindfulness, living in a mindful, healthy life, living a mindful and healthy life involves so many things about being present and being aware of the moments that we have in our lives, the activities that we do and share with family and friends, and the way we eat and move. Mindfulness originated in the Eastern meditation tradition. And when we think of meditation, most of us think of, a monk seated on a cushion or a chair, eyes open or closed, spine straight, not moving. And that is true for some forms of meditation, but there are so many different ways that we meditate and so many different kinds of meditation that are available to us now. Some focus on opening your heart, so loving kindness meditations or metta. Sharon Salzman does a lot of that, and Jack Kornfield and Inside LA does a lot of mindfulness, loving kindness, awareness kinds of meditations, which are important to keep our hearts open. Some are work on expanding awareness or inner peace. Some are mantra-based, so repeating sounds and words in a mindful way that can be calming and change the actual vibration of our bodies and our cells. So there are body sweeps and body scans, and John Kabat-Zinn brought MBSR, which is mindfulness-based stress reduction, to the West with the University of Massachusetts, and has there are many programs out there that just deal with this body scan style, which helps really connect you to your body and reduce stress and anxiety. And we had a lot of success with those kinds of programs and that style of meditation. Of course, there's moving meditation, Tai Chi, there's mindfulness yoga now more and more, and there's even walking meditation, where you just focus on how you're moving from one foot to the other, rolling through your feet and being very mindful where you position your feet and how you change your weight as you walk. Meditation is an internal practice, usually for a specific amount of time. It's formal. You learn to focus inward, to become calm, to increase your concentration and equanimity, your emotional or psychological balance. Turning deeper inward. But what is mindfulness? We hear this a lot. We hear this word all the time. Mindful eating, mindful walking, being mindful. And mindfulness, like you've heard a lot tonight, is being aware. It's noticing and paying attention to your thoughts, your feelings, attitudes, behaviors, the effects you have on people around you. Mindfulness can be used in any situation throughout the day. So you could be mindfully washing your dishes and taking ordinary moments and creating a meditative state. You could be petting your dogs and cats, and I love to do that. Just be really present with them, looking into their eyes, feeling their fur, watching their breathing, looking at the way they're looking at you. So there's all kinds of things that you can do to create a sense of calmness and to take time to be aware of the moments in your life, to stay present. And Jon Kabat-Zinn, a well-known author and meditation teacher, defined it this way. Mindfulness means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So living in the moment or mindfulness is a state of active, open, intentional attention. It is challenging for our minds to stay focused on our tasks, and they did a recent study at Harvard and found, okay, I'm going to ask you to guess and just yell it out. What % of your mind in the waking hours do you spend thinking about other things out of 100%? What do you think? 90, that's probably the way we all feel, but 46.9 or 47% of the time, almost half the time, we're not paying attention to what we're doing. Our mind is elsewhere. And so much of our thoughts are on the past with regrets, or in the future, planning, worrying, and not being here now, not being right in the moment. So these researchers also found that the mindless autopilot kind of thinking, or mindless thinking, makes people unhappy. A wandering mind is an unhappy mind, and that's what they concluded. So mindfulness can help. You're in luck, and you can do your practice of mindfulness anywhere at any time with anyone. So you can really start to experience mindfulness sitting right here in your chair, and we're going to be doing a mindfulness exercise now. It means being conscious and aware of the present with all of your senses. It means concentrating on the task at hand, leaving the past in the past, and letting go of the worries about the future. Mindfulness, in essence, turns each ordinary experience into a meditation. So let's get mindful now and enjoy the benefits that we heard earlier in the discussion. There are many. So let's sit tall and long, stretching the spine in your chair. Feel your feet down into the floor. Feel an evenness of the weight distributed through your feet. Spread your toes. Feel your sit bones in the chair. Close your eyes. Let your eyes just drop down into your eye sockets. And begin to pay attention to your breath. From the inside, let yourself relax and become curious about your body, seated here, the sensations of your body, the touch, the connection with the floor, the chair, Relax any areas of tightness or tension and just breathe. Soften and begin to tune into your breath. Feeling the natural flow of your breath. You don't need to do anything to your breath. Not long, not short, just your natural breath. Notice where you feel your breath in your body. It might be in your abdomen, feeling the rise and the fall. It might be in your chest or the throat. Or maybe you can sense it and feel it in your nostrils, feeling the cool air moving in through the nostrils and the warmed air moving out. One breath at a time. Noticing the sensations of each breath. And as you breathe, you might notice your mind wandering. That's perfectly normal. That's the way we're wired. You may be thinking of other things. And if this happens, it's not a problem. It's very natural. Just notice that your mind wandered, and you can label that as thinking or wandering gently in your head. And then tenderly redirect your attention right back to your breathing. Noticing your breath. Noticing the in-breath and the out-breath. Noticing the expansion on the inhale and the softening on the exhale. And you might notice other things that pull your attention away from your breath. And that might be sound. So for right now, just for a moment, bring your attention to the sounds inside of this room. Simply listening. They might be pleasant sounds. They might be unpleasant sounds. Just listen to them with curiosity and interest, noticing the sounds come and go, just as you noticed your breath come and go. Without getting caught up in a story about what the sound is or why it's there. You're just simply listening. You might also notice the sound of silence. And now letting go of this hearing, this listening, bring your attention into your body and notice if there are any body sensations to be aware of. There might be pressure or tightness, or movement, or vibration, heat, or cold, tingling. Notice which sensations call out to you, and just let your attention go to these sensations. They might be very strong and obvious, or there might be soft and subtle sensations. You might notice yourself jumping from sensation to sensation, or there might be one that grabs your attention and holds it, particularly if it's unpleasant. And you might notice it. Is it growing or shrinking, moving? Does it pulse, vibrate, ache? Just notice with curiosity. Bringing your attention into the sensations of your body. Not making up any stories about the experience. Just noticing. Let your body go to the sensation, feel it, sense it. Sometimes if you label the sensation, it will disappear. Sometimes it continues. And if the thought keeps going in a repetitive way, check in with yourself and let yourself be curious about what's arising. Where are your thoughts? And if it feels like it's too much, you can always return to your breath. That's your anchor. No matter what's happening in your awareness, whether it's sounds or body sensations or emotions or thoughts, you can always find that place to return to. If you can't stay with the breath because your attention gets pulled away, then let yourself go where it goes. Focusing on a sensation or a sound or your breath until it no longer holds your attention. And go back to your breathing. returning to the simplicity of your anchor, your breath. Just breathing. Now notice your whole body, again, sitting here in this moment, tuning into your shape, the posture, movement of the breath, your feet on the floor, your sit bones on the cushion of the chair. Allowing yourself to relax, feeling the expansion and the release of your breath. And you can wish yourself well. May you be happy and at ease. May you be free from stress and anxiety. May you be peaceful. And may you let yourself consider the possibility of finding peace and ease and well-being. And then gently wiggle your fingers and your toes. And circle your ankles and your wrists. And open your eyes. And maybe stretch the arms over the head and give yourself a nice deep breath, inhaling and floating the arms down, watching your neighbor exhaling or floating down in front. And thank you so much. You've been a great audience.
Thank you, Valyn. I got to wake myself up to get up here. Okay, we're going to take a short break. Members of the Miracle Living Committee will be coming around with pencils and papers and for you to write questions on. And as you know, we don't take any shouted out from the audience because those won't be recorded. So put your thinking caps on, come up with your questions, and then we will, after the break, address them to our panel. I thought for a moment our dietitians had been kidnapped. I'm glad to see that is not the case. We are going to get started here with questions, of which we have sufficiency. Do you have another one coming up here? No, you have some trail mix, all right. Okay. We have a number of questions about shingles and shingle shots. I'm going to start with Dr. Ellis here. Let me see. If you've had a shingles shot many years ago, do you still need the two new shingles shots?
Okay, if you have the older shingles vaccine, which is known as Zostavax, and is still available, the manufacturer of the new one says yes. But the reality is it's still not a bad idea. The newer vaccine is a little more comprehensive, and tests have indicated that it tends to be overall more effective than the original one, which is still available. So I would recommend it. If you don't get it, at least you do have some coverage if you've gotten the older one.
Okay, and as a follow-up, does the shingles vaccine cause shingles blisters? Is there any?
No, I understand.
What are the side effects, in other words?
Yeah, it should not cause blistering. Blistering is actually you would get from the shingle, from actually having an outbreak of shingles. The vaccine should not cause that.
But I understand you might get a a sore arm or something.
Oh
Somebody's-
yeah, most and
Yeah.
a lot of vaccinations. The most common side effect is injection site pain, even burning there. So that is not uncommon.
Okay. This would be for our two dietitians. What do you think of the trend to eliminate milk from the diet only to be replaced with plant-based substitutes, oat, almond, cashew, hemp, etc.? There is a lot of discussion that we were not meant to drink milk or eat dairy later in life. What are your thoughts?
So it really depends on, I guess, your preference. So if you do decide to drink milk, we'll recommend maybe 1% or skim. But if you're concerned about things like the treatment of animals and you want to gear towards more plant-based, like almond milk, there's rice milk, there's oat milk, there's pea milk, there's so many options. So that's the nice thing. There's a lot of options. However, with dairy milk, you're getting your protein. So you just have to be kind of careful if you do choose to go with other types of milk. There might not be that protein content in there. I could go on about this. So I feel like, I guess that's my answer, right, to your preference. But I would never recommend maybe whole milk or 2% unless you're trying to gain weight.
Okay. I'm not quite well. Let's see. Who wants to take this? Does mindful... Oh. If you want to... I'm going to rephrase this. So, if you want to practice mindful eating, is it better to be eating alone? The thought being, if you're with someone else, there's always a distraction.
That's a good question. So when you practice mindful eating, when you start doing this, like if you're just starting to practice it, it may be helpful if you do this alone, since they do recommend you eat in silence. And if you're doing this with somebody else and you're eating in silence and not talking to them, they might take offense to that. So if you are just practicing it, I would say, yes, it would be helpful. However, in real life, you're not always going to be eating alone, and you shouldn't. Probably it's good. Eating is supposed to be a social event that we do. So it's once you start to adopt some of those mindfulness practices, then it's just checking in with yourself during the process of social eating to make sure that you're tuning in to your cues, how full you are, and maybe using some of those helpful external cues to help stop yourself before you overeat. So say something that I recommend for my patients often is, if you're eating out, why don't you go ahead and get your box at the beginning of the meal, box up half the meal before you even start, so that there's a smaller portion, and that way it doesn't encourage you mindlessly eat.
Okay, let's see. Pardon me. Do pneumonia and shingles vaccines need to be repeated, and if so, how often?
The shingles vaccine does not need to be repeated. The pneumonia vaccines are recommended at age 65 and above, but you may have noticed I mentioned that if you have certain conditions, you can get it earlier. If you do get it earlier, then it is recommended that once you get to 65, that you do get a second version of one of the pneumonia vaccines. So your body immune system gets re-stimulated. Sorry.
Okay. Let's see. I'm not quite sure who should take the interesting question. What are good foods to eat if you're feeling nauseous?
We'll share that one. But as a doctor, when patients come in complaining of nausea, I usually recommend bland foods. Quite often that means things that we normally tell you not to eat. The most common thing you may have heard of is brat, B-R-A-T, banana, rice, applesauce, and toast. Starchy foods just to calm your stomach down. Stay away from dairy when you're particularly nauseous, spicy foods, acidic foods. This is usually what I recommend when someone's having recurrent bouts of nausea, just keeping it really bland for your stomach.
Something else that can help is smaller, more frequent meals rather than large meals if the person's feeling nauseous, as well as doing liquids between meals rather than at the meals to help prevent a large load of food at one time. We also do recommend that our patients eat when they're feeling the least nauseous. So some people that's in the early part of the day, or some people it's later in the evening. So we do recommend, in addition to the tips that Doctor mentioned already, those tips as well.
Should we be eating peanuts even though they're not really a nut?
I guess my question is, what's your concern with peanuts, other than it not being a nut? Is it, I guess, in the sense of mindful eating, and remember what I was talking about when you're directly eating from a bag or container, peanuts is a #1 culprit for that. And I have a story on that. I had a patient, he was following his diet plan to the T, but he was still gaining weight. We couldn't figure out why. Turns out, so his healthy snack was some peanuts, right? But in a day, he was eating 500 calories worth of peanuts. That was why he was not losing weight. So a handful of peanuts, that's the portion size, right? But if we're eating it from the container, oh, that bag, 500 calories, there it is. So I think it can be part of your healthy snack. So you don't have to just say no to peanuts, but portion it out.
Right. I think, at the risk of messing it up, I'm going to take this question myself. Asked, what is the scale of the BMI for men and women? And I believe the answer is in the handout as to underweight, normal, and overweight. So I'm just going to check out the handout. It's in there. Let's see. Okay, interesting question here. What recommendations do you have for a senior couple with very different food preferences? And they're suggesting DASH versus meat, potatoes, and salty foods. No?
Okay. From my perspective, couples, it is easier to eat healthy if both of you commit to the same healthy plan. If one of you is doing something else, it's harder for both of you to stick to it. Yes, I would recommend less meat and potatoes, more whole grains overall. So for both of you. But like I said, food should be something you enjoy. As both the dietitians mentioned, it's about eating, being conscious about what you eat. I'm not saying don't eat a steak if you want it, but be aware that you may not need an 8 ounces of red meat. You know, if you're eating consciously, you may find you're full way before you finish that much meat. It's all about being aware of what you eat, how much, and what you're doing, what your body is telling you. All of it is about listening. Our body sends satiety cues to us and tells us when we're full. We're just in the habit of cleaning our plates, and that's not always necessary.
Another thing that I found helpful with my clients, especially when one is trying to follow a diet plan and the other is not quite on board, is learning about it together. So we encourage them to bring their spouse into the appointment when they come and meet with the dietitian. That way they're hearing it from a third party, like, hey, this is a very healthful way of eating. And then also trying to discover some of the barriers for that second spouse. Why are they so resistant to a different type of eating plan? And also, what are some things that they are willing to do? So a lot of times, a huge overhaul of a diet for anyone is a little bit unrealistic or definitely hard to follow. But if you can find maybe one small thing that they're willing to work on, maybe it's working on portion size of the meat, or maybe it's, okay, we're going to have meat and potato, but we're going to add a vegetable at every time that we eat that meal. That can be a small change that sometimes the spouse would be open to. And so those are some things to start to get on the same page. And oftentimes, especially if I think they mentioned it was an elderly couple, they've been maybe eating that certain way for a very long time. So I like to say that if it took you 50 years to develop these types of habits, it's going to take some time to develop some new ones. So you have to work at it slowly and in small steps.
Okay, Dr. Ellis, if I had whooping cough as a child, do I need a pertussis shot?
Yes. You don't, but if you got the shot as a child, you were probably covered again for a good portion of your life. But as you get older, as I was saying before, you should repeat and get another pertussis shot.
Okay. Well, I think that person actually had whooping cough and not a whooping cough vaccine.
Oh, if you had the whooping cough, that doesn't mean your immune system now protects you from some things you get and your immune system protects you from. That's not one of them. You do need the vaccine.
Okay,
Yeah.
thank you. Let's see, where do we go next? Okay, yeah, interesting lifestyle problem here. How can I change/manage my thinking at work when there are always chocolate, cookies, sweets of all kinds, hot tamales out in the open for all to eat? I don't know where this person works, but asking others to remove them is not an option.
Right, so like Kristen said, out of sight, out of mind, but that's a little tough there. And I don't know if this is a space you can completely avoid, or instead have things that are readily available that are healthy, you know? So instead of going for the donuts, going for the cookies, well, I brought in this tray of other things that are healthy for me, and I know I can enjoy that and not feel guilty. So have a plan B when plan A is all donuts and cookies, okay?
Dr. Ellis, how important is it for seniors to get the double-strength flu vaccine?
Yes. In my office anyway, we don't even offer the regular. If you're once you reach 65, we don't even offer the regular strength. It's automatically the double strength. The reason we do what we call the higher dose vaccine is your immune system is less responsive as you get older. And the whole point of us giving you the flu vaccine is to help you have a strong enough immune response that if you get exposed to the virus, your body is ready to fight it off. So it is very important to get the high dose.
It is, okay. All right. Can you comment on eating grain-fed animal meat? I don't think it's a yes or no question.
There's some discussion about whether the diet of the animals that we consume affects the nutritional quality of the meat. When we can eat meat that, say for example, chickens that are able to roam free, sometimes that does affect the quality of the muscle tissue, just because, say, if they weren't able to run around, then sometimes the fat content of that chicken is higher than, say, a chicken that was able to run free and roam free. In addition to grain-fed beef versus maybe grass-fed beef, oftentimes the grass-fed beef cows are roaming free as well. So some of those things can affect the nature of the nutritional quality of the food that we consume. Even, for example, eggs. Some you might have seen like omega-3 eggs advertised, and what they do is instead of the normal feed for those chickens, they feed with like flax seed in them, and that actually does affect the omega-3 content of those eggs. So sometimes those things do affect it, but a lot of times some of those regulations are not tightly regulated. So if it says cage-free, grass-fed, sometimes those things aren't quite regulated so much. Organic is definitely one of those things that is regulated so that we can trust. So that's just one of the caveats about some of those natural, grain-free, grass-fed beef, those types of things.
Okay, at my last colonoscopy at age 80, my doctor said I don't need to have any more of these in the future. Do you agree?
Yeah, usually at around age 80, we often say we don't repeat it. The reason is if you've had a series of clean colonoscopies up till that point, then we're fairly confident you're less likely to develop something. And your life expectancy from age 80 decreases significantly. And if you've been that clean, the next one would be at age 90. And it's a really invasive, at that point it becomes really uncomfortable. You're 90, getting that sort of test is not comfortable. You have to get anesthesia and everything else.
So the key sounds like it's clean colonoscopy.
Yes, if you've had a number of polyps consistently, then you're most likely they're going to tell you to come back in 3 years, or 5 years, or even 2 years just to monitor you. But if you've been cleaned up to that point, then I totally agree with the gastroenterologist who said that.
Okay, thank you. Let's see, question for, pardon me, our dietitians, I think. How would you suggest slowing down, sitting down to eat, savoring, etc., when you have little or no downtime at work or at home, on the road quite often, and have small breaks at work? Oof.
So I think that's really tough. We all lead really hectic lifestyles. But, mindful eating and mindfulness in general, it's to help us lead healthier lifestyles. So it's almost a commitment that you have to make to yourself. And it sounds like you said you have small breaks. So even if that break is, say, for example, 15 minutes, so you can maybe commit 5 minutes and sitting down and centering yourself and remembering what, we just did, but instead of a whole half an hour, you can commit that 5 minutes. And then slowly, as you have more time, as you can find that time, you can commit to a little more. But it's tough. We all lead really hectic lifestyles, and we do have to maybe prioritize. It's not easy. I will admit, it's not easy.
Another thing you could do is maybe choose one meal or one specific food that you eat to practice with. So say, for example, you do have a couple more minutes at breakfast time. Maybe make that a time when you really try to sit down and be mindful, knowing that the rest of your day is going to be crazy, but at least you can take that one moment or that one food to really practice with. And some people even need a visual reminder. So say you choose maybe a certain food to practice mindfulness with, you can just write it on the box, like be mindful, or something that's going to be a visual cue for you that every time you do go to eat that food, you can remember, okay, let me just take a moment and just be present with this, put everything away, and just be able to focus on practicing attending to my body during this eating experience.
Okay, I think I'll read this just the way it's said here for Dr. Ellis. Not having pap smears after age 65 is baloney, right?
Well, the American College of Obstetricians and Gynecologists are the ones who pretty much set the standard on that. There's a lot of the reason is the incidence of cervical cancer decreases dramatically, which is why we don't tend to do it above 65. For the guys in here, you have no idea, but it's a very uncomfortable test for a woman. And it's, at age 65, the incidence drops so low that, yes, you can still get cervical cancer, but it's low enough that they don't think that the risk benefit reward is great enough that they recommend doing it consistently. If, however, again, it's the same thing with the colonoscopy. If you've had problems along the line, they may say it's all individual. All these recommendations are based on what's going on with the individual patient. and they're based on the general populace, the median. Most people is this, most people is that. But if you're not most people, they will tailor it accordingly. You may need to continue having Pap smears well beyond 65.
Okay, thank you. Our last question, pardon me. What is the best way to get rid of scary thoughts?
We all have scary thoughts. There are several different ways that you can look at that, and it's a good question. My teacher, Shinzen Young, I have a lot of scary thoughts, and I sort of broached that with him. His response to me was, because I was perseverating, I was like, focused on really scary stuff that was going on. So we talked about how things are impermanent, right? When we were doing our meditation, nothing stays the same. It's not permanent. It's not, solid. It moves, it breaks up, and changes. So one way that you could deal with that is to really be with the scary thought and the scary emotion and feel where that is in your body. Maybe it's in your pit of your stomach, or in your chest, or in your jaw, to become mindful of where is that manifesting in your body, and to be totally present with it. For many of us, that's really scary. And so, his advice to me was, if it becomes overwhelming, then shift your focus. Do something that's calming, like mantra, or focusing on your breath. And the meditation we did, anchoring into the breath, is truly helpful, especially if you're, in an anxious state and you're really involved with those thoughts and the reactions in your body to those thoughts. But if you can anchor into your breath and know that those thoughts are thoughts, they're not, the solid reality. This is a thought that you're having, and a thought is an event. It moves. So right now you might be scared or having, repetitive, frightening thoughts, but 5 minutes from now you might not. So there are ways that you can move through it if you're able to. The same thing with pain. And there may be times where it's just too much and you need to move to distract, listen to music, work on your breathing. So that's the way I would answer that.
Thank you. That's it for the questions, folks, and let's give our panel a big round of thanks.